Hi, everybody. Welcome back to the Rossi Pavilion, my favorite room at the National Arts Centre. We had to take a detour off to the Pacific Room, overlooking the mighty Pacific, but we're back here tonight. About 20 years ago, when I started writing a column for the National Post, one of my colleagues said, you know, I enjoy your column, it's very funny, you take nice shots at everyone, you say this guy's an idiot and this one's a crook and so on, but you never actually just say, I like so-and-so. And so about almost 20 years later, I think it's, I've built up enough credibility in this town. It's time to blow it and admit that I admire Jane Philpott quite a bit. Me admiring Jane Philpott will not save her, though, if her job ever hits a speed bump, because she's got one of the most difficult jobs in government, one of the most difficult jobs that ever existed in government, one that was invented for her to handle. She's the Minister of Indigenous Services of the Government of Canada. It is a challenge every day, and she insists that it is often one of the most rewarding jobs that you could imagine, and she's going to tell us about both parts of that job tonight. Jane Philpott, come on up. How are you?
Very well, thank you.
Welcome. Thank you for joining us. Your staff was very worried that you might not even be able to join us. That would have been a challenge because we're live on TV because of votes in the House of Commons. But the House of Commons rose for the summer today.
Thankfully.
I wanted to know, what is your state of mind as the House of Commons throws in the towel for another summer? Is that a relief?
I'd say it's a bit of a mixed feeling of satisfaction, having made it through another calendar year, and a bit of relief of the schedule and flexibility. I'll still be just as busy, but a little bit more time to get out to communities.
You are still fairly new to politics. You had never run for Parliament before 2015, and you were a healthcare administrator before then. I often wonder, for someone who's now into politics so far that it's going to be hard to get out, how do you find it? What is your sense of politics, and how does it compare to your expectations of the thing?
Well, I don't know whether anyone who goes into politics really understands what it's like till you get there. It's somewhat indescribable, and I'm sure we all have different experiences of it. But I would say I've been surprised at how transferable the skills and experiences I had as a family doctor are to the political world. You're still trying to listen and gather a history. You're still trying to do some objective analysis of what's going on. You're trying to make a diagnosis and then develop a plan. So I feel like my medical training actually slides fairly easily into politics. It's very, very hard work, but I'm really glad that I had the opportunity to give it a go.
What's question period like for a new minister?
You know, question period is probably not my favorite time of day. It's an important part of the democratic process. I think there's lots of room for improvement in what that process looks like. I actually love question period in the Senate. I don't know how many of your viewers have been to question period in the Senate. It's quite a different style. There's a lot more time for both the questions and the answers. There aren't television cameras there, which I think helps a little bit. And we really dig into an issue. So I think that has demonstrated to me that actually there are better models out there for actually being able to still be critical of what the government's doing, but actually give pause for reflection. Okay.
Now you represent the riding of Markham?
Mm-hmm. Markham-Stouffville.
Markham-Stouffville. It used to have an even longer name, Markham-Witcher-Stouffville.
Oak Ridge's Markham was the most recent previous version.
Okay. Tell me about, pick a town, Markham or Stouffville. What are they like?
Well, I'll talk about Stouffville, since that's where I've lived for the last 20 years. It is a wonderful town. It used to be quite small. It has a tagline, country close to the city, so we're right on the edge of the Oak Ridges Moraine and now on the edge of the beautiful Rouge National Urban Park. But on a good day, you can get downtown Toronto in 45 minutes. It's a town where, because I was a family doctor there for 17 years, I go to the grocery store every weekend and always see somebody I know. They don't ask me about their medical problems as much as they used to, but it's a place where you can really feel at home. Okay.
Bill Morneau last year had during the whole tax small business tax unpleasantness. He had an event in your riding at an Italian restaurant, and you told me on Twitter it was a pretty good Italian restaurant. What's good about it?
Lots of things are great.
Questions get harder,
Oh,
I'll tell you
wow,
right now.
yeah, this is great. So far, you told me you were going to ask me hard questions. Okay, so here's the scoop. It was called Pistachios on Main Street in Stouffville. What's great about it is the food, especially the mozzarella balls. But what's most great about it is the people who own it, the family who own it. They are charming and welcoming. My closest friend, who happens to be a family doctor, is the family doctor for the family. So when she and I go there to eat, there's long discussions about medical. Everywhere I go, you can tell in Stouffville, there are long discussions about medical issues. But it's got a really warm feeling to it. And when you walk in, you get a hug from the person who's at the door.
Okay. Can you share with us any information about their tax bill?
No. I don't.
Okay.
I don't know, but they were pretty excited about having the Prime Minister and Minister Vorno come for a visit.
I know that at the time there were parts of the country where feelings were a bit mixed about that, but but I think that's calmed down for now. The other sort of highlight of your career, or the thing that always gets mentioned, is that for nearly a decade you spent time in Africa, in Niger.
Yes.
Providing health services and stuff like that in the 90s. Why did you go, and what was that experience like?
Okay, it's a long story, so I'll try to keep it brief. I had started in medical school taking an interest in international health, in part because of some of my colleagues, other students who had worked internationally. So in my final year of medical school, I spent 4 months in Western Kenya, and my eyes were open to a world that I had not seen before, and I came to realize in a way that you can't get through books or media, the fact that the world is a very unequal and unfair place, and that the kind of health care that we enjoy here is not experienced by most of the world. So I came back from that and did my training in family medicine and tropical medicine, and decided that I wanted to spend the first part of my medical career in a place where I felt the kind of skills I had were less available. And so we lived in a wonderful little village about 500 kilometers east of the capital city in Niger. And they were amongst the happiest years of my life.
And you went back several years later to Addis Ababa for a more sort of short-term project, which was? So,
you know, once you've spent some time in Sub-Saharan Africa, it's hard to get it out of your system. I loved the people that I got to know there. When I became a professor at University of Toronto and realized that actually the way that a healthcare person can be helpful in a less resource setting is not necessarily delivering clinical medicine directly, but actually through teaching. So I realized that Ethiopia did not have a family medicine program, and I was part of a partnership between the University of Toronto and Addis Ababa University, and had the incredible privilege of visiting multiple times over a number of years and helping to see the launch of the first family medicine training program in Ethiopia.
Okay. Now, how much of what you did on those missions, those periods of your life in Africa, how much of that is applicable to what you do as a healthcare administrator, or what you do as Minister of Indigenous Services?
I think there are profound connections to particularly the portfolio that I'm in now. As I said, I think my experiences in Africa changed my life permanently. And the overriding message was that the world is a very unfair place, that while, you know, intelligence, this is to paraphrase a quote of Bill Clinton, who once said that as you travel the world, you see that intelligence, aspirations, hopes and dreams are equitably distributed around the world. What's not equitably distributed is the mechanisms, the opportunities, the systemic capacity to give life to those dreams. And so I learned that in part through my work in Sub-Saharan Africa, but what I've come to spend much more time thinking about right now is that those very same inequities exist in a profound way here in Canada as well, in terms of the lack of fair distribution of opportunity and capacity. And my job is in part to work with First Nations, Inuit and Métis to close those opportunity gaps and therefore the socioeconomic gaps. And
in a lot of ways that job hasn't really changed between your being health minister and being Indigenous Services Minister. Your angle on a lot of those challenges is different. But you were handling these challenges like from day one as health minister.
Well, thankfully, when I became health minister, which was a fantastic privilege, and I'm very thankful that the Prime Minister asked me to do that, I had some big pieces on my portfolio, including things like assistance in dying and the cannabis file and the drug policy file, but one of the big pieces of my portfolio at that time was the First Nations Inuit Health Branch, which was at that time a part of Health Canada. So when the Prime Minister asked me to move into this new portfolio, I was very grateful that he said that at the same time as we opened this new department, that we would bring over the First Nations Inuit Health Branch to be part of the new Indigenous Services Department. So some of my old job I got to hang on to.
Okay. It's an interesting thing about this government. It talks all the time about the middle class and those working hard to join us. But a lot of the most intractable social challenges that any government is going to face are long-term homelessness, long-term poverty, chronic disease, challenges facing people who can only dream of joining the middle class at some point. And that's been a large part of your own professional preoccupation since you moved to town. Talk about that, I guess, a little bit.
Well, you're right that one of the overarching messages of our government is our commitment to making sure that we grow the middle class, and the way you grow the middle class is in large part by finding the less affluent and figuring out what it will take for those people, those Canadians, to join the middle class. And it's some of the things that I talked about is giving access to those kinds of opportunities. So our focus on addressing these social inequities that exist in multiple portfolios. Of course, Minister Duclos is working on things like homelessness and our new national housing strategy, which is great. But there's no question that amongst those who have faced the most severe economic disadvantage in this country for a very long time, one needs to look no further than to Indigenous peoples. And while Minister Bennett continues to deal with the long-term relationship, my portfolio is specifically looking at what are those day-to-day life issues that will allow Indigenous peoples to much more, in much larger numbers, be part of the middle class and be able to have the economic advantages that every Canadian aspires to.
Okay. There are all kinds of ways to talk about your assignment, whether it's your mandate letter or the organizational structure of the department, but I thought I would ask you about a name that comes up fairly frequently in speeches that you give as you talk to groups around the time. That's Eileen Cooney Lucy. I think the name will be familiar to you, and it's a story that I think more people should hear.
Yes, and so this was a story. Her name happens to be in the public sphere because an article was written about her after the time of her death, I believe, by a CBC reporter. Otherwise, I wouldn't share her name. But this was a young girl who died right here in the city in Ottawa about 18 months ago now, I believe, at the Children's Hospital here in Ottawa. And it was not known until just a few hours before she died what the diagnosis was, even though she'd had symptoms for over 2 years. And it turns out that she died of overwhelming active tuberculosis. So right here in this extremely affluent city, in a very affluent province, in a very well-to-do country, a teenager dies of tuberculosis. But what I often say about Eileen's death is that it was not ultimately the bacteria that killed her or was the true cause of her death. Her story is actually wrapped up and it's the subject of an investigation, which more details presumably will come out at that time. But in terms of what's on the public record, it's the reality of the fact that she, like most of her peers in Nunavut, lived in very overcrowded conditions, that she had symptoms for 2 years which were never diagnosed. There were huge challenges associated with her being able to get to a health center. When she reached a health center, like many people in Nunavut, it's likely that she wouldn't have been able to have a provider who would have been able to speak to her in her mother tongue of Inuktitut. And there are challenges even to get there. So you just find in a story like that, it shows you that in this country, we have not until now really been seized with the fact that it's unconscionable that Canada's Inuit live with tuberculosis rates that are 300 times the rates of the non-Indigenous Canadian-born population. And this is a disease that has been treatable for generations, and that in fact we don't have drug-resistant TB in Canada. Why have we not ever had the political will to do what it takes to be able to see that young girls like Eileen don't die of a completely treatable disease, which we should have known about much sooner?
It's an extraordinary story and really quite heartbreaking. And the question that comes to mind is, how does a Minister of Indigenous Services begin to fix that?
Well, I think like many things, it takes political will, for sure. None of these things happen unless you've got that will. And in this case, it takes the will not just of the federal government, but obviously for something like tuberculosis, we've got provincial and territorial governments that are involved. But I would say what's the most powerful in this case is that the Inuit Tapiriit Kanatami and its leadership, currently under President Natan Obed, were completely seized with this issue, and we collectively have determined to take it on. It takes meticulous organization. Any of these big challenges that we have don't happen by wishing it were better. It takes an incredible plan, and therefore we've put together a tuberculosis elimination task force. It takes resources. So there are, of course, the resources around medication and x-ray equipment and diagnostics, but the biggest cost in something like this is addressing the housing issue and the severe overcrowding that takes place. So, you know, usually if you get enough money, enough ambition, and you have dogged determination to follow a very detailed plan, those things should come together to see change.
Okay. Now, you got your current job last August 28th, I believe. Mm-hmm. How long beforehand were there discussions about splitting Indigenous Affairs into two departments? The wisdom of that kind of organizational change rather than just trying to drive files through the existing department. How long was there a run-up to that decision?
Well, I would say more than 2 decades, if you want to really go back to the real story of the change. There's a fantastic document, which I encourage anybody who watches this tape to have a look at. It's called the Royal Commission on Aboriginal Peoples. It's actually I think a 5-volume set. It's obvious, I don't expect people to read the full 5 volumes of it. But if people Google Royal Commission on Aboriginal Peoples highlights, you get a document that's about 70 pages long. It is probably the most helpful document I've read in the last 10 months. Actually, I think I read it before I got this job, but in the last couple of years. And the Royal Commission, some of the commissioners are actually still alive today, but it was looked at some of the issues that we're still facing today. And one of the very practical recommendations was this idea of splitting the old Indian and Northern Affairs Department. We talked about that at a group that's called the Working Group of Ministers on the Review of Laws and Policies. So we like these long names. And it was a group of my fabulous colleagues who sat around and have been meeting with people over the last couple of years and looking at the laws and policies and operational practices that are in place in our government that perpetuate the inequities that I was talking about. And one of the things we did was to look at the Royal Commission. And there were conversations that were had with the Prime Minister's office about some of these kinds of things. And, you know, obviously it's the Prime Minister's prerogative to make the decision, but there was a lot of positive feedback in terms of trying to follow up on some of those recommendations that were put in a document 21 years ago.
Okay. I read your mandate letter again this afternoon. It is long. Even by the standards of ministerial mandate letters, you've got a lot of requests from the Prime Minister to try and tick off before you leave the portfolio. What's the biggest challenge that you're facing?
Wow. I think the biggest challenge, you know, I would say the biggest challenge isn't directly within my portfolio. So my portfolio, we've sort of, I find things are easier to work with when I categorize them. And so we very early on decided to sort of look at what the priority issues would be of our department. And the top priority issues are around child and family services, education, healthcare, infrastructure, and economic prosperity. So once I've got it down to 5 things, it's easier to kind of make sure we've got a plan in each of those areas. But what's actually underlying how we're going to be successful in terms of addressing the practical day-to-day life issues on each of those areas is not in my portfolio. It's a whole of government job that we have to do. And that is the fact that the reason that the deep socioeconomic gaps exist in this country is because of past government policies, and some of which still are in place, including discriminatory policies like Indian residential schools. And that's based on the fact that for a very, very long time, approximately 150 years, Canadians and Canadian governments have denied the rights of Indigenous peoples and had policies that whereby we wanted to dominate Indigenous peoples, we wanted them to assimilate into our culture, and essentially rid the Indian in the child, for example. I can make a lot of progress on each of my files, but unless we collectively, as a government and as Canadians, wake up and recognize and affirm the rights of Indigenous peoples to be able to control their lives, to be able to heal their culture and revive their spirits, I will not be able to be successful. So that's the hardest thing to do. I can't do that myself. That's a all of Canada job. But when we get that right, which will take some time, then all of the other things like, is it right that people should have access to clean drinking water? Is it right that people should have equitable access to education, whether you're Indigenous or not? Those pieces make much more sense once Canadians understand that we have to respect the rights of First Nations, Inuit, and Métis.
It's interesting because when the 2 departments were set up, there was a lot of commentary to the effect that your colleague, Carolyn Bennett, is in charge of Crown Indigenous relations, essentially the conceptual and philosophical and symbolic piece, and that you're responsible for plumbing. You're the practical minister. But what you're saying is that you can't do your job without that other stuff.
That's right.
Okay, why not?
Because we've been trying to do that for 150 years, and it's been an abject failure. And the Truth and Reconciliation Commission speaks to that. My favorite of the TRC calls to action at the moment, I'll reserve the right to change my mind on which is my favorite over time, but at the moment my favorite is number 18, which calls on all orders of government to acknowledge that the deep health outcome gaps that exist between Indigenous and non-Indigenous peoples are on the basis of past government policies, including residential schools, and that the solution is to recognize and affirm rights. So as long as you treat Indigenous peoples like they don't have the same rights as you and I who are I assume you're non-Indigenous, unless you've got a history that I'm not aware of, and you continue to deny those rights, we will never be able to, as I say, have the funding that's necessary, but it's also the control that's necessary. So we see what happens when you actually give people control over their lives, which is a basic human right to self-determination, and it's certainly an inherent Indigenous right. We look at examples like education, where about 20 years ago, the Mi'kmaq were affirmed in their right to run their own school system in Nova Scotia. And at that time, just like we see across much of the country right now, the graduation rates of Mi'kmaq kids were far, far lower than other kids in Nova Scotia. But But over the last 20 years, they have built one of the best school systems in the country. Federal government has nothing to do with it except to provide resources for it. It's entirely designed, delivered, managed by Mi'kmaq for Mi'kmaq. Their graduation rates, as I understand it now, are actually higher than the provincial average in the Mi'kmaq school system. And we see the same thing in all kinds of other sectors. So what that proves to me is that when we affirm and support the implementation of rights and give people control over their lives, they actually do better, and my job is unnecessary.
Okay. You've said that you hope eventually that your department was founded in the hope that eventually it would be obsolete. I assume that's not going to happen like this week.
No.
Do you have any sense of a timeline for something like that? Or is it just purely aspirational?
It's somewhat aspirational, but it's actually something that we intend to track over time as we look to see how more and more educational systems and school systems and child welfare agencies are entirely led by the people they're intended to serve, and we do have a methodology around tracking that in the department, so that we will be able to at some point, I think, set a target date, but it's not anytime very, very soon, in part because there's a broad spectrum of where communities are at. If you look at First Nations, for example, there are dozens of original First Nations and hundreds of Indian Act bands across the country that are all in very different levels of desiring or being ready to entirely be self-governing, and so it will take some time.
It's the stated hope of this government that a lot of these different First Nations and Indian Act bands will reorganize themselves in larger aggregates so that they can take delivery of government services and government funding and deliver more coherently the kind of services that their people need. Is that something you're making, or that they're making progress on?
Well, the thing about self-determination is that it's not determined by people outside. So, how, in the case of First Nations, how they will decide to coalesce or aggregate is to a certain extent an organic process that will happen according to the readiness and the expectations and the cultural desires of that particular group of people. This is not an idea that we invented, of course. It's something that Indigenous peoples have spoken up for a long time. It's something that the Royal Commission on Aboriginal Peoples speaks to, and I think it's part of what Canadians kind of are starting to learn to wrap their heads around, because most of us didn't understand that what the Indian Act did by, tearing apart groups of people that belonged together and drawing lines around them on the map and then calling them a band, separating them from another band, which was actually part of the same people, that was part of the damage of what the Indian Act has done over time. But as I say, there are many people who are much greater experts than me at this. I give a shout out to my colleague, Minister Wilson-Raybould, who, as you know, is a remarkable First Nations leader and one of our fabulous cabinet colleagues who has been a real mentor to me in terms of understanding what the potential hope for the future looks like. But there are many other smart people out there who I look to teach me, and I'm constantly learning about how we're going to get from where we are to true reconciliation. Okay.
Meanwhile, concretely, on a case-by-case basis, it must sometimes feel like it's 2 steps forward and 1 step back. I want to quote from a speech that you gave last November, I believe in this building, I'm not sure. You said on boil water advisories, or on water advisories generally, that we made a lot of progress. We've lifted 26 of them, and there are 70 left to go. Today, on Twitter, you said we have now lifted 64 water advisories, and there are 74 left to go. That's a higher number than the one from last November. Can you explain how?
It's a higher number that's lifted too.
Yeah, that's sometimes how I feel when I'm running. It's like that 10th kilometer is just not ever going to get here. What's happened since last November on that file?
Well, I will try not to burden your audience with too many details, but We, as I said, part of how I think we will be successful in our department is to have a meticulous plan. And before we formed government, there was not as far as I know, and I'm told, there was not a spreadsheet with itemized every single boil water advisory that had been in place for longer than a year, and a specific plan as to how that would be addressed. We now do have that, and we track it very, very closely. In every one of those boil water advisories, we know, what stage in the process they are, from design to construction to testing and training. What ended up happening as we first looked at how big our list was at first was we began to hear about communities that had boil water advisories that weren't on the department list. And at first we were told, well, some of those are in gas stations or other private facilities, so those aren't the responsibility of the government. But when we looked closer at the list, we realized, yeah, but some of them are in nursing stations or community halls, and surely those are the responsibility of the federal government to support fixing them. And so we made a decision which we announced last January, was that we were going to make our work harder, because it didn't seem right to ignore the fact that the list we had originally thought was incomplete. And so we added to our list, so that's why it grew from the very beginning. We also realized that as we were trying to fix this list that we had decided upon, if we weren't looking back over our shoulder to realize that there were other long-term drinking water advisories that were being added, because we weren't also paying attention to the ones that were at risk of becoming long-term. So we now also have a plan for everyone that's at risk of becoming long-term, and that the pace of adding numbers is slowing down, and we think that we are actually going more steps forward than we are backward. And I have said very, very clearly to my department that failure is not an option. The Prime Minister has mandated me to deliver on his promise to make sure that all long-term drinking water advisories for public systems on reserve will be lifted by March of 2021. And I need to know if there's a roadblock or a reason why we're not going to get there, but my absolute expectation is that we will get there. And in fact, if we can get there sooner, that would be great.
Okay. A bit of an Ottawa question. How much autonomy do you have as a minister vis-a-vis the Prime Minister's office and what used to be called the Langevin block? Do they check in on you daily, weekly, monthly, or do you are you basically running the joint? And how much autonomy do you have from your deputy minister, who I was told might be here tonight?
I don't know if I haven't spotted my deputy. He may be hiding somewhere in here, but he'll definitely check later to see if I behaved myself. But I have a lot of autonomy. Obviously, everything that we do as a team, and much of my work involves the work around the cabinet table on other issues that aren't just within my department, and that work is clearly done in collaboration with other cabinet colleagues and the Prime Minister. But in terms of my particular file, we have an incredible amount of autonomy, and the Prime Minister, I believe, trusts me and has high expectations for what I need to do, and that I need to let him know when I need his help. And he made that very clear to me from the time that he asked me to do this job, was to say, we're going to lay out what we expect. We're going to trust you to run with it, but come back to me where you need help. And I've done that. So on things like addressing the Canadian Human Rights Tribunal and the issues around child welfare, we realized very early on we needed more money to be able to fully implement the orders of the tribunal. And so we went to both the Prime Minister and the Finance Minister and said, this is not an option. We're going to need more resources on this. So that's, I think, a healthy relationship where I have the privilege of trying to work alongside fantastic officials and a fantastic office in my department, but at the same time, they have my back.
Another large file that is a subject of constant preoccupation with you is the child welfare system. Mm-hmm. The context is a bit ironic. This morning, the Prime Minister took a question about the situation on border states in the United States, where parents are being separated from their children, and the Prime Minister said it's wrong. I can't imagine what it's like for the parents and especially for the children. And he said, this is not something we do, obviously, in Canada. And I've seen commentary all day long that says, well, actually, sometimes it is, or it certainly has been, and to some extent still is. Children are separated from their parents, as you yourself have said, every single day in Indigenous families. And that's something you've said about trying to change. Tell me a bit more about that whole nest of issues.
So let me say, first of all, just in terms of the Prime Minister's comments, that he, I think, was referring to how we treat people at the border in terms of our approach to the separation of children. The Prime Minister would absolutely agree with your comments in terms of the fact that we do still have this terrible over-apprehension of Indigenous children. This was an issue that really came to the forefront for me very early on in my experience in this portfolio. I think one of the first trips I took in this portfolio was to Manitoba, and one of the first meetings I had there was with the Assembly of Manitoba Chiefs. And they started to present data to me that blew my mind. They showed me their data that in Manitoba, even now, there are over 400 babies taken from their mother every single year. There is a particular hospital in Winnipeg at which almost every single day a baby is taken from that mother. They have a system called birth alerts, so that there may be essentially a mark on the chart that the mother may not be aware of. Apparently there's currently no obligation that's upheld for her to have been pre-informed that she's been marked and that her child will be taken from her. The reason the child would be taken from her may be because she was a child in foster care herself, or because she's too poor, or because she doesn't have a private bedroom for that baby. I was blown away by what I heard and thought, this can't possibly be true that we are actually doing this. And then they started to talk about the fact that in Manitoba, there's 11,000 children in foster care, 10,000 of them are Indigenous. And then you start to hear the individual stories about a young woman I met who had 4 children taken from her, one after the other. Her dream was to be a mother, and the world was against her right from the start, partly because she had grown up in care herself and never had the opportunity to be built to be prepared to be a successful mother. So, as I say, this was all in the context of also realizing that we had outstanding orders associated with Canadian Human Rights Tribunal. So we set about to, I said, this is, this is absolutely abominable. This can't go on. We should know what happens when families are separated, the damage it does to those children's lives, the damage that it does to parents who will never fully heal if their children are taken from them. And so I won't go into all, this is something we could talk about all day long. It's a major preoccupation of our department, but we did hold an emergency meeting, pulled together all the people that we thought had to be part of that. We put together a 6-point plan. We're now looking at engaging across the country on the possibility of legislation around Indigenous child well-being. And I must say that while it's still, I think, horrific and it's still going on, we are also starting to see signs of hope. And I'm starting to hear of work where families are being reunified. And I think this will, it's one of the things that I think about every single day.
First question on that is truly the motivation for that system, however misguided or off track it's become, is the safety of children. Are there not families where the child is not safe in that home?
That's a good question, and you're absolutely right that the motivation for the system is protection of the child. In fact, I always have to be careful that, I don't unfairly suggest that the people that are working in those systems nor the agencies that they're associated with are not trying to do very good work. but they're working under rules that are not necessarily fair. The way the funding has worked until now has been that the only way those agencies can get funded is essentially more money flows, the more children are apprehended, which is a extremely disturbing incentive. We've changed that and are in the process of making sure every agency knows that you actually can get paid to prevent the apprehension of children. The data doesn't bear up what you're suggesting, though, in that we take kids away to protect them. And in fact, there is data emerging that actually is documenting that, in fact, children are less safe often in foster care. Again, not to generalize, but there is no proof that by apprehending these children at the rates that we are is keeping them safe. And the other thing is that surely there's better ways of addressing our concerns about that child. Surely we should find ways that if there's an aunt or a grandmother who wants to care for that child in their culture and community, we should support that aunt or grandmother. Surely if the parents are, for instance, dependent on substances and for that reason someone's anxious about the baby, well, the worst thing you can actually do to a person who is dependent on substances is to rip apart from them the very thing they may love most in the whole world and add to their trauma. Can we not find ways that we could provide treatment for those parents who may have addiction or other health issues and somehow keep that family bond with the child, which will in fact lessen the psychological pain and therefore lessen the dependency on substances. So those sound like I'm trying to describe those things like they're simple. They're not, but we clearly have to have a whole fresh look at these kinds of issues so as not to have to be saying 2 generations from now, oh my gosh, wasn't it a horrible thing that was being done in the early 21st century when children were being taken away from their parents.
And I'm actually conscious that I'm bouncing back and forth between questions about human issues and questions about administrative issues, but they're often hard to dissociate. Sitting here in Ottawa, do you have the kind of fine-grained tools that you need to address these situations on the ground? Child welfare services are administered by the provinces. Each case is different. Can you make appropriate change at this distance from those issues?
Well, like I often say when I'm talking to people who are feeling overwhelmed by the challenges that are there, what frustrates people is that systems don't change and that there are discriminatory policies in place. Well, I always say, we're the government. Like, if anybody can fix the policies, we should be able to, right? So tell me what are the policies that are getting in your way and help me figure out, you know, what I can do to change them. I mean, if you don't mind me using an example from my past portfolio, I look at some of the work that we did on drug policy and having access to opioid substitution therapy or prescription heroin, for example, for people who are dependent on substances. And it was when I went to visit clinics in Vancouver who said, your rules are really keeping us from being able to do the right thing to care for these patients. And I came back to my department and said, apparently we have rules that are really getting in the way of people being able to prescribe the right treatment for these very vulnerable people. And next thing you know, the department finds the person who's writing the rules and we're making regulatory changes and allowing people to get the treatment they need. So that's the magic of government, is that, you know, we need to make that diagnosis as to what the challenge is and figure out who has the levers. But if I don't have the levers, I can probably get on the phone and talk to the person who has the levers and gradually be able to address the on-the-ground issues that make people so frustrated.
See, it is talk like this, Jane Philpott, that has gotten you a bit of a reputation around town as a strangely decisive minister. Do you ever run into people around Ottawa who have a hard time making a decision, and do you have advice for them?
I'm not sure whether I want to answer that question.
I sure want you to.
It's. I don't want to imply that it's easy. It's not easy work. I guess maybe being a little bit older, I feel like my time here is short, and I mean, I guess for all of us, we don't know how long our time is in any particular job, and I just want to get stuff done. And so, and I think people want to get stuff done, right? You know, when I look at my officials in my department who are often heavily criticized, not necessarily fairly criticized, you know, they too have been under a system that suppressed their enthusiasm and ambitions. But when I look at them and I say things to them, we start talking about housing policy, and I have a little bit of a passion around finding a way that we can be able to see that Indigenous peoples will someday be able to live in beautiful homes that are built out of the fantastic natural resources that surround them, as opposed to the horrific disposable homes that are currently seen on many remote communities. And I start to see people's eyes light up and they say, yeah, that would be great. It's like they just need someone that will say, yes, we can do this, we can do it together. And then people work so hard, our officials work crazy hard. They just sometimes need to know that there's somebody there that will champion them along the way, and tell them that you should never be afraid of a new idea, you should never be afraid to experiment, and you should never be afraid to test the system, as long as your ultimate goals are honorable.
Okay. Another frustration that I imagine you might run into is the people are so used to not hearing good news from federal governments on these files. And they're so used to frustration on these files that it's kind of assumed, it's built into people's assumptions. So that, for instance, when the federal government buys a pipeline and announces plans to build to twin that pipeline out to the ocean, you read just about everywhere this government has taken no account of the objections of Indigenous populations along the way. I assume you don't share that analysis, and I assume it's a frustrating analysis for you after all the work you put in.
The challenge of making sure that we have been fair and adequately engaged with all the people that want to be involved on decisions is a huge challenge. Not in any file. I'm facing the same thing, as I say, on looking at the possibility of child welfare legislation, and how are we going to make sure, when will we know that we've talked to enough people and gotten enough views, because there are 1.7 million Indigenous peoples in this country, and as one can imagine, they're not homogeneous in their mindset and opinions on issues. So when it comes to really hard decisions, like the resource revenue development, you're going to get a range of responses. But I think we have been working very hard to make sure that we've engaged with more people than ever before. I look at something like the cannabis legislation, where the ministers involved spent an enormous amount of time consulting with Indigenous peoples, and there will continue to be people who will say that we didn't consult enough. But I think we are getting better. It's not a matter of having done the engagement or consultation, then it's over and we're never going to talk to you again. It's about having a relationship, and making sure that people know that they can reach us, that we are always open to views, and to trying to lay down guidelines for ourselves for how we will be able to say that we have adequately talked to enough people and to make a smart, thoughtful decision to go forward.
Okay. We've got about 10 minutes left, and I've been getting questions online and from the room here, things that people want to ask you about. One of them is about your old portfolio. This is the day that we learned that cannabis is going to be legal in Canada sometime in mid-October. Not being a consumer, I've forgotten the date already, but honest. But one of the questions was, how does the legalization of cannabis fit into the huge nest of issues surrounding opioid use and abuse and addiction and overdoses. Does one help or aggravate the other?
It's an excellent question, and one that people ask a lot. And as you've pointed out, I'm no longer the Minister of Health, so I don't want to imply that I'm speaking on her behalf, but just because it interests me and because you asked, I'll take a crack at answering that. The work that we did around making sure that cannabis is now going to be legal and is regulated is based on well-documented, evidence-based public health policy, that you maximize the education for people who may be interested in using products which are potentially harmful and figure out ways to minimize the harm. But we know that prohibition of substances, be they alcohol or cannabis, is an ineffective way of actually protecting people from the harms of these substances. So how that relates to opioids, there are suggestions that cannabis being available as a legal product will potentially be used instead of more dangerous products such as opioids. I don't think that the evidence is clearly there yet, but it's something that I think now that we are going to have a legal product of cannabis, that will be something that will be studied very quickly in the coming months. But you know, I think these are still, we have a lot to learn as Canadians, and yet we're also going to be the ones who are now going to be able to be leaders in research around some of these particular questions.
A lot of the same activists that you talked about who told you that the rules are messed up, they just about all say, look, if you're going to legalize marijuana, just legalize them all, you know, and that way you've got the possibility of providing safe, medically safe, legally obtained product to people who are going to use it anyway, and they won't have to spend the entire rest of their day figuring out ingenious ways to come up with the money and break the law to feed their addiction. This government has said no.
Well, you can see that we have now successfully been able to work through the legalization of cannabis. It's been a very long road to get there. And it takes time for people to decide that that's the right thing to do. What I will say around substance use in general is that I think we need to do a better job as a country treating addiction as a health issue and not as a moral issue or as a crime. And I think there are good models out there that without changing the criminal prohibitions on other types of substances, that you can still look to models where we use, when people are determined, or people are identified as having a dependency on a dangerous substance, that they can actually get into treatment for opioid substitution therapies that will be safer for them, and still realize that this person, through, for whatever reason, psychological pain or trauma, needs to keep taking a substance, and we don't want them to go out in the streets and buy drugs that might be laced with fentanyl. Why don't we actually get them into a clinic where they can get an alternative product that will address their dependency and at the same time deal with the social issues that may have driven their addiction in the first place. So, you know, I don't think it's an all or nothing. I actually think that without going to the route of looking at further decriminalization, that we can actually look at better ways of approaching addiction and substance use disorders.
Okay. Maybe a closing question, we'll see. I'm not entirely master of my fate here on timing, but I was struck by some language in the Prime Minister's mandate letter to you, where he, almost the first paragraph of the letter, he asked you to leverage the ingenuity and understanding of Indigenous peoples to identify ways to improve delivery that are holistic, community-based, and put the needs of the person first. It's an idea that we don't often hear about, which is that your stakeholders are not simply an endless list of you know, horrible stories and policy challenges, that they bring their own genius to some of these issues. Have you had examples of that in your day-to-day work?
I could sit here for the next 3 hours or more and tell you all of the genius things that I've seen in the last number of months. I'm happy to share one or two fantastic things, and you're absolutely right that the genius is out there and needs to be harnessed. And the people who I work with, I wouldn't call stakeholders, but partners in the work that we're doing. A great example that I love is the Métis Nation of Alberta, when I was in Edmonton, showed me a housing project that they had put together to address family reunification and this issue of Métis children in the child welfare system. They went to the province of Alberta and said, you know, how much money are you spending on keeping these families apart, essentially, and paying for foster families to take care of these kids? And it's thousands of dollars a month per child that's being paid to have kids in foster care. They said, if we actually developed a system where we would use less money than what you're currently paying foster families, and we took that money and pooled it collectively and brought parents that want to be reunited with their kids back together, we could use that money to renovate an apartment block. So they bought a building with 8 apartment units in it. They financed it through the Alberta Child and Family Services resources. They actually spent less money than Child and Family Services would have spent to have these kids in foster care, and they were able to completely furnish and renovate 8 beautiful apartment units and have 24-hour staff that were providing social work and skills counseling and therapy for these families. And the families stay for anywhere from 1 year to 3 years and relearn to be a family in a place where they're supported and they can seek help and they can get back on their feet again to restart as a family. So we're saving money, we're bringing families back together, giving people hope and setting them on their way, much more empowered to be successful, both the parents and the children. There are things like that happening all across this country that would blow your mind. I could tell you stories of fantastic housing projects that I've seen. I could tell you about this incredible place at Six Nations where IBM is partnering with Six Nations Polytechnic on an academy where kids are getting their high school and college diploma together, and they're studying the state-of-the-art technology beside Haudenosaunee arts and culture, and they're graduating a whole bunch of students who otherwise might not have made it through school, but now are going to not only get their high school, but their college degree and be some of the most sought-after technical students in the country. So everywhere I go, I see stories like that I am glad that you're giving me a chance to amplify, because there absolutely is hope, and there absolutely are genius ideas out there waiting to be given an opportunity to fly.
Okay. There's rumors of a cabinet shuffle at some point in the next 3 months. You don't sound like you're scrambling to get out of your portfolio.
Well, I like to think I have the best job in the country, so we'll see. I will do as I'm asked to do, but I'm really privileged to be able to do this work. I don't do it alone. I do it with a lot of really wonderful people. So.
Well, we're really grateful that you've taken an hour to come and explain it all to us, because I know every time your name comes up, people have a lot of questions about what exactly is she up to. And so thanks for shining a little light on that. And enjoy your summer, and I hope a little bit of time off, and we'll see you back in the fall.
Thank you for the privilege of being here.
And thanks to everyone else for coming out.